I'm Helen MacDonald. I'm a clinical editor at the BMJ. BMJ has been involved in preventing overdiagnosis since the start of the conference, and it's a really important topic for us. We've got a long-standing interest in medicalisation, and we have a campaign on too much medicine. So when this conference launched some 10 years or more ago now, it was a must for us. I think in the scheme of too much medicine, overdiagnosis is a particularly important point because it's often the diagnosis or the diagnosis of increased risk of a problem that starts a cascade of testing and medicalisation for patients. As we begin to put the programme together, we think about a couple of things. We think about who's going to speak, and I also think from a BMJ perspective about what can we publish coming out of this conference. And at the Journal, I think we have an opportunity to do two things. One is to be a mirror of the communities whose work we publish. So there's a degree to which we want to showcase what the latest thinking is on this issue. The other is that we want to be a spotlight and to search out areas where it might be hard to go there might not be very many people working on that issue, and to show people important areas. And I think as we put the programme together, that's always something that we consider. What are people talking about? But also, as a group of experts who've been following this issue for a long time, what do we think needs more attention and showcasing at the conference? And we try and put together a broad programme, because I think one of the things we've come to understand over the years is that overdiagnosis is pervasive throughout medicine. So whether you work in public health, whether you work in sort of screening, trying to prevent illness, or whether you're a jobbing doctor working in primary care or as a specialist, there'll be conditions and labels that you apply to people which may not be helpful to them. And there's been a trend, I think, throughout medicine where diagnostic criteria have tended to expand and tended to include more people, and some of those people don't benefit from that labelling. I think quantifying the issue of overdiagnosis has been one of the really big challenges that the committee and the conference community have been talking about. It's a very hard thing to measure. So there are some really interesting technical discussions that go on at the conference about how do we research and try and quantify those things. And then there's, on the flip side, to make those data and those numbers come to life, people also want to hear stories from patients, because that's what connects not just with the public, but with clinicians who are interacting with patients. And that's been another challenge, because people who have been overdiagnosed often don't know that they've been overdiagnosed. And many of them feel fortunate or lucky that their condition, their cancer or their particular diagnosis has been caught in time for them to do something about it, and they haven't suffered any adverse effects perhaps. So that's been a real challenge that continues to face us, is quantifying the problem and finding people to speak about the downsides of receiving some of these labels. I think overdiagnosis is as much a problem now as it was when we started, and arguably even more so. And I think there's a few aspects to that. One is that we have an ageing and more comorbid population than before. Secondly, we have healthcare systems that are reaching capacity and are having to make choices about what to do and what not to do. So understanding what is not helpful and what is not a good value spend of time and money is very important. The other thing is, I think we understand much more clearly now that we live within planetary constraints and environmental considerations. And if there are treatments which aren't bringing benefit to people and they're also damaging the planet, then those are the ones that we want to get rid of. So I think as we look across the globe where resources are constrained, policymakers, politicians should be increasingly interested in spending their money wisely and on things which are going to improve outcomes for people and the planet. And I think that's why the conference is important, and that is very much the mission of BMJ. I think one of the great things about coming to a conference like Preventing Overdiagnosis is it's quite small. There's a established community, but a very friendly and welcoming community. And that community is very broad. So it includes people, it includes clinicians, broadly healthcare professionals, not just doctors. It includes policymakers, it includes people who work in public health, it includes patients, it includes researchers. And I think that multidisciplinary approach, and community is a really nice place to come and meet people who are all working with a similar ethos, that they want the best outcomes for the patients that they have. You should come if you're interested in the broad idea, and then you should come specifically to take advantage of what the program has to offer. So we're going to have some big keynote sessions with well-known people from the field, experts talking about well-known examples and how they're moving this field forward. You should come if you want to present the work that you're doing, to receive feedback from that community and improve it for publication or for implementation elsewhere. And you should come if you just want to meet people and make connections with people working in this space to take it forward in your organisation, whatever that means.